housing and health go hand in hand. You can't really have good health if you don't have secure housing, if you don't have community around you, don't know where you're going to live year on year, or you don't know how you're going to make rent, that constant stress. It's natural for that to impact your health.
I'm a respiratory specialist. I do a lot of work with people with airways disease, and housing just kept coming up in all the conversations I was having. So we would talk about why someone's asthma wasn't controlled, and we'd kind of go through the list and we'd cross off, they're not smoking anymore, we've removed any obvious triggers like pets, they're taking all their meds, they're on the right meds, and still they were coming to me saying, I'm really sick. I started to realise that this was a really common problem that I was not looking for. The answer was their housing. Cold, damp, mouldy homes, which really my treatments could do nothing for.
There's the physical stuff of damp, mouldy, cold homes that are making people ill. But then there's also the psychological thing of living in a house where the next step from this is street homelessness. That has an impact on everyone, on the adults in the house, the kids in the house. And really if you're not dealing with what's causing that, you're not dealing with it at all.
The NHS crisis is strongly linked to both the energy crisis and the housing crisis. None of these are separate issues. They are all completely meshed together. And we need to stop pretending and trying to treat them as isolated issues. Because until we fix the housing crisis, we're never going to get a grip on the NHS crisis.
The NHS was never meant to stand alone. At its inception, our first health minister was our housing and health minister. Housing wasn't separate to our health. Housing has always been acknowledged to be fundamental to our health. But today we see a system of profit, of greed, and our health is no longer considered.
Right now we have a housing system where it's profitable and it's beneficial to a small number of people to keep other people that don't have the same economic or social power as they do to keep them downtrodden, basically, to exploit them. The solution is just simply to build a housing system that doesn't hurt people.
I got involved in housing through Medact. So much of my work led me to see the social consequences and the impact that was having on people's health. I have a lot of faith and belief in the medicines that I give to people, but they are in reality very limited in terms of what they can do for people's health. As I progressed through my training, that feeling of being quite powerless to really truly help people got stronger and stronger. And that's how I found Medact, where I found other people who felt the same and who were coming together to do something about it.
Medact it's fundamentally a health justice charity for health workers or people in the health community. One of our causes is our Homes for Health campaign. Nationally, we work and we call for more social housing, for rent controls, for energy affordability, and for mass insulation and ventilation of our poor quality housing stock. This is not okay. It's not okay to sit by and watch this happen. As health workers, as a health community, we're coming together to fight for our rights, for everybody's rights, because my housing won't get better until your housing gets better, My patient's housing won't get better until my housing gets better. It's all one thing. We're made to feel powerless, but we're really strong when we come together. And we've shown that with our campaigns. We've shown that working with our allies. We've shown that working on a local grassroots level with our communities and making real change happen, something I really never felt I was doing when I was a health worker. Hundreds of health workers have joined the movement for housing and health justice. You can join too. Sign up to Medact today.